Good morning, everyone, and thank you for being here. My name is Joanna Zook. I'm the Acting Director of Communications at Hamilton Health Sciences, sitting in today for Erin Levo. I'm pleased to be with you to moderate today's town hall for March 9th, 2023. Our agenda includes our operational update, along with some information about some of our top strategic priorities, including workforce planning, digital health and governance, and the research strategic plan. Just a little housekeeping off the top. We do have the Q&A function open, so you can type in your questions throughout the presentations and our panelists will answer those questions. And then the answers will appear in the Answered tab within the Q&A function. At the end of our town hall, we'll make time for celebrations and we'll use the chat function for that. You'll also have the opportunity to raise your hand and give your shout out or celebration live, should you wish to do that. So the Q&A function for questions, and then the chat function for celebrations at the end. President and CEO Rob McIsaac is attending a government announcement at the Ron Joyce Children's Health Center this morning. So instead, I'll pass things over to Dave McKeag, our Executive Vice President, Corporate Affairs and Chief Financial Officer, to open today's town hall. Dave, over to you.
Thanks, Joanna. Welcome everyone to today's town hall. It is a little bit of a town hall with a couple of sit-ins as Joanna and I do that. So good morning and thanks for giving us some of your time today. Rob and Sharon are both attending that event at the Ron Joyce Children's Health Center with some of our colleagues, and two provincial ministers, Marilee Fullerton and Jones, are both there for some announcement, and it relates to a new program to support families of children with complex medical, behavioral, and social needs. So we'll hear more about the details of that in the dispatch later today. So why don't we get going? But I would like to start by acknowledging that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. So a few other things to walk through. I would also like to take a moment and reflect on some important observations taking place this month. Yesterday, of course, being International Women's Day, an annual global event on March 8th, and this year's theme is Embracing Equity. I'm honored to recognize that many women at HHS of their dedication and determination to deliver the best care for all. And last week, several women at HHS were also honored as nominees for the 2023 YWCA Hamilton Women of Distinction Award. So, and then further, I am very pleased to also let you know that two of our own, Dr. Sonia Anand and Dr. Natasha Johnson, were award recipients. So congratulations. We're so fortunate to have these individuals on our team at HHS. So really on behalf of everyone, congratulations. And also congratulations to all the nominees representing organizations in Hamilton and Halton. So you'll see more about that on the hub, and you'll see an HHS share story about these remarkable women, and I hope you take the opportunity to read more about that. In recognition of International Women's Day, some of you may have also attended a webinar yesterday about women in tech and innovation and gender equity at a special webinar. A sincere note of thanks to all the speakers for sharing their experiences and perspectives. Okay, so also this weekend, Saturday, March 11th, we will be lowering our flags to half-mast in memory of those who died due to COVID-19 over the past 3 years. This is in alignment with the Government of Canada, who will be lowering flags across the country in memory of all those individuals. So this is also a time for us to acknowledge the remarkable efforts, truly remarkable sacrificial efforts of all of our staff and physicians to care for our patients during the pandemic and the worst of the waves. So thank you again for your ongoing dedication to our community and our patients and their families. Later this month, there is a lot this month. Later this month, on March 31st, we'll also observe International Transgender Day of Visibility. This day recognizes the struggles, sacrifices, and achievements of those who have fought and continue to fight for gender equity, or even just equity. Information and resources related to Transgender Day of Visibility will be shared via the dispatch and on the hub closer to that date. And as you're already aware, or I hope you're already aware, work is underway to develop a plan at HHS to address racism, discrimination, and oppression that has been the experience of some individuals at our hospital. It really is our collective goal and responsibility to ensure that equity, diversity, and inclusion guide all that we do. And only together can we create an environment where every person in our hospital feels included, safe, and respected. Treat others like you would like to be treated is a bit of a personal motto. So information about this broader and important EDI work will continue to be shared with you regularly. So a lot of stuff covered there. Just before I hand it over to the rest of our speakers, I also wanted to acknowledge those that are supporting the hospital's operational budget financial planning work for the upcoming fiscal year. It's truly an interesting time right now in our sector. A lot of unknowns and a lot of things sort of culminating post-COVID expectations of COVID recovery, as well as what is our new financial reality in this economic environment. Lots of unknowns. So we're slowly getting more direction from the government and expect to know more about the provincial funding allocation in the coming weeks. It typically takes the ministry several weeks post provincial budget to work through their allocations and understand what the art of the possible is. So more to come on that, and appreciate your patience, especially those working on this important planning work in a sort of environment of uncertainty. For today's town hall, we have a pretty packed agenda. Over the course of the next 30 minutes or so, we'll hear more about workforce planning, one of our key priorities within our corporate strategic plan, and something that hopefully will be felt by all of you around the organization as those plans take hold and we see staffing firm up. There is no initiative more important to us than recruitment and retention, and making sure that we do all that we can there. We'll also learn more about the hospital's digital health and research strategic plans. So again, as always, thanks for your ongoing efforts for all of our patients, community, and for each other. Although it might feel like we're pushing a boulder up a steep hill, at the very least, we're doing really good work and making progress on our priorities. I see what other hospital organizations are doing, and always feel that HHS, we are right amongst our peers, or leading in many ways. So thank you for all that you do. I'll hand it over now to Neil to give us an operational update.
Thanks, Dave, and good morning, everyone. I'm pleased to be here. As David said, a number of us are pinch hitting for others, and as David said, that Sharon is at the minister's announcement right now, and so I'm pleased to join the event today and to share some of the operations update. I also want to thank Dave for highlighting International Women's Day and for the award winners that he mentioned. Just want to echo Dave's comments and my personal thanks and best wishes to every woman who works in this organization, who serves and makes such a valuable contribution. And again, congratulations to those award winners that Dave had mentioned as well too. So lots of going in our operations, and if we can go to the next slide here, I'll just start off with a few of the facts and the statistics. Obviously, we're mentioning that we're marking COVID as this weekend in terms of an anniversary, but as well, COVID is still part of our normal daily work here at Hamilton Health Sciences. And these are the numbers that show the numbers of patients who are in our facility in inpatient areas right now, plus the staff that are in self-isolation. So not as bad as it has been before, but it is still quite significant. We know that we have, I believe it's 4 areas on active outbreak. We had a few weeks there with none, which was really optimistic and positive. We know that COVID is still in the community, although not perhaps as bad as it has been in the past. So this really reinforces to me the fact that we need to continue to be diligent in our infection control practices, our masking, gowning, all of the other measures that we need to take to protect not only our patients, but ourselves. And so that's an encouragement to continue to do that. Next slide, please. We are just chock-a-block full with patients, and this is really something that we put up the numbers in terms of percentages and patients who are what we call alternate level of care patients, who would probably be best be cared for or live somewhere else at this time. And I'm always reminded when I look at these percentages that these percentages reflect the people that we serve in our community. And so, you know, at the site that I'm at today, we're at 114% occupancy. That means over 460 patients, people from our community that we're serving today in sometimes very challenging circumstances. And so this continues to be a very challenging work for our staff, our physicians, volunteers, as we try to cope with these very, very significant pressures. And it's through the hard work of our staff and our physicians, their creativity, that makes our ongoing operations possible. But behind each one of these percentage points is a story of an individual, a patient that we serve. And we always have to remind ourselves that in the midst of even the most difficult circumstances of lots of patients or a great number of patients and high occupancy, that we have to do our best to meet their both their physical, their social and psychological needs as they journey through us. So lots of work, and thank you to the teams for their ongoing work on this every day, day in, day out. Next slide, please. From a capacity overview, we still have, again, a great number of challenges on other parts of our operations as well, too. So our surgical portfolios are working hard to get back to pre-COVID levels. We know that both in HHS, but also regionally and provincially, there's a great backlog of cases, and ours is in the thousands. Our teams are working to try to do the best that they can under the circumstances, recognizing that we have limited staffing in some cases, limited physician workforce in other cases, and of course our beds being a challenge for us in terms of being able to provide the care. So there's a lot of work going on with that. Just because a patient is not in our facility and is waiting on a surgical wait list doesn't mean that their needs aren't significant. And so we are really trying to make every effort possible to get caught up, but also to make sure that everyone who comes through our door has timely access to surgical and procedural care as well too. Our emergency room visits still remain fairly stable. They don't change much over the years, although they do grow. We've had some really important improvements, though, at the Juravinski Hospital site in the last 2 months, both with some investments from the government, but also some major process changes. As you know, ambulance offload times have been a real challenge for our organization, and particularly at the Juravinski site. And we've seen sustained performance over 2 months now, reducing 50 to 60% offload times. And so in talking with the chief of EMS, he's very pleased with the efforts that we've made. And again, very encouraging to see the hard work of all of our teams, changing the way we perform our business, but also that it's sustaining itself, even amongst all of that occupancy that we talked about on the previous slide. So there's great work there. You'll hear and see some charts in a minute about our alternate level of care patients. And really, this is really at a historical high for our organization. And year over year, when you take a look at where we were last year at this time versus this year at this time, we're seeing a 40% increase in patients who don't require acute care services. So they don't need to be in our hospital for that. They could be at home, they could be with care, they could be at a long-term care home or some other care setting, but they don't need to be here. And so 40% of those patients we're unable to help them transition to the next place that they'll be living. And so very concerning, because that obviously affects the occupancy numbers and all of our overall operations. And it's very dissatisfying for those patients and their loved ones as well too, who would rather not be in our organization, who would rather be in a different care setting. Next slide, please. This graph, I think, very accurately describes probably the felt experience of many of our frontline nursing staff, care staff, volunteers, physicians. When you take a look at the number of patients that on a regular basis we have in either unbudgeted or unconventional spaces. And so some of those obviously are ward spaces that we have that are just not our ward rooms that are just not budgeted. So they are a patient room, but some of them we know patients are having to wait in hallways for care and spend periods of time there, or in spaces that is not normally programmed for patient care activities. And this is a challenge for our staff. It's a challenge for the family members and the patients as well too, and it's not ideal for anyone. And so this is really a significant concern and continues to grow over time. So it ties into that overall access picture. Next slide, please. As I mentioned, the alternate level of care experience that we're having here, this gives a graph to what I've talked about, and you can see the marked growth really in the last 6 to 8 months of our alternate level of care patients, and that's even with opening up resources in the community and so forth. Next slide, please. I've got 2 other slides. I'll just give you a little bit more of what's going on. You know, we are trying to take actions to try to mitigate this in very difficult circumstances. And, you know, really the heroic effort in some cases of our staff and physicians to take this work on. So we know our express units at various sites are staying open 7 and 24 when they're usually only open, you know, part of the day, not for 24 hours. I think at the Juravinski site where I'm at here, it's probably been about 75 or 80% of the time that's been open. We have patients in PACU who are staying in off-service ward areas. Les Gillies' team has opened in response to some of the acute pressures a few weeks ago, beds at St. Peter's, a really Herculean effort to put that in place and to care for patients in that setting as opposed to some of our acute care settings. Rehab has been pitching in, and we've had holdovers in the ICU, and each and every day, each one of these tactics seems to be a little bit different, but these are the things that are going on each and every day just to make sure that our patients are receiving timely care. Since January, we have had intermittent closures of our acute leukemia services. That's a provincially garnered program. We work in close contact with other providers across Ontario, but we have had to close to patients who are from outside of our region in that provincial system. We've shifted cases to same day or overnight care. Surgical cancellations have unfortunately occurred as well, and sometimes we've had to close on an episodic basis to some of the non-regional program ICU patients as well too. So these aren't areas that we want to be in terms of having to do it, but this is having the response that we've had to do to care for our organization. And then lastly, just the next slide, I think, you know, lots of work going on around admission avoidance. We still have the flu, COVID, and cold clinic. The virtual care models are really helping out. As well, there's lots of work going on with post-acute care strategies. So that's where we're trying to get people to community beds in the home, in homes or hospital and home programs. So lots of work going on. The bullet points, I'm sure don't do it justice to the work that's going on a daily basis with our teams. But thank you for the work that you're doing to care for our patients and our community and keep them safe and providing effective care. Back to you, Joanna.
Thanks, Neil. Thanks for the update today. Next on our agenda, we have a presentation about workforce planning, specifically about opportunities within our model of care. This is from Interprofessional Practice Chief Yelena Potts and Interim Chief of Nursing Practice, Diane Norman. So Yelena and Diane, over to you.
Thanks so much, Joanna. So as Joanna introduced, Diane and I, who is our co-lead of the Model of Care Task Force with the executive leadership by Leslie Gillies, will be giving you an update on some of our work. Next slide, please. I wanted to ground you first in the root of this work. And of course, within our strategic plan for 22-23 fiscal year, you can see a section here with the highlight of the yellow star around the transformational program. And the final bullet in the grouping of 4 is workforce planning. So we are directed and report up to that workforce planning committee. And so next slide, please. That prioritization has been identified because of the reality that we work in and live in really every day. We have human resource shortages across the world, and they are similarly an extreme challenge here at HHS. Like all of our North American partners, HHS experiences staffing gaps across all clinical roles, all disciplines, including our administrative roles and our physician roles. And as a result of those challenges in our workforce, we have shortages that impact our service stability. Some of those things that were just identified by Neil Johnson. And you can see for these reasons, our board and our executive leadership team has identified that workforce planning is a major, in fact, a key priority within our strategic plan. Next slide, please. This slide is a visualization of how our work is connected through workforce planning. Our model of care task force is accountable to workforce planning. Workforce planning, as you can see, is led by Leslie Gillies and Aaron Levo as our executive leads. And we are one of 5 programs of work through model of care task force. That's our square in the center with the box around it. You can see the other boxes. They represent the 5 inherent interconnected areas of work. Was already highlighted that recruitment and onboarding and retention and management support, and as well as the data to help us understand how we're doing, are key priorities for our work. And so us as working group leaders are always communicating and collaborating to ensure that our work aligns together. And I'm going to hand it over to my colleague Diane, who's going to share with you some more specifics about the work that we've been doing in the task force.
Next slide, please. Thank you, Yelena. We recognize that there continues to be pressures across our systems, and Neil has already demonstrated that clearly in the earlier presentation. Our teams are working hard to ensure the continued delivery of safe, quality care for each and every patient. Thus, the immediate need and the concentrated focus of this task force is to stabilize our teams. To enable this, we're guided by key principles. As noted, the model of care committee's goal is to enable more sustainable and flexible staffing models. But we also recognize that in order to sustain the safe, quality patient care, this model needs to remain rooted in both patient acuity and complexity. Given the human resource challenges facing healthcare today, a significant amount of focus to date has gone into exploring opportunities to supplement our teams with unregulated health professionals. Of course, the success of this work will require continued strong team-based collaboration. Next slide. So what have we been doing to date? This work started with an assessment of our current workforce and of strategies that are in use to support care delivery. This assessment, along with both internal and external recommendations, has guided our work. Subsequently, we've begun to create standard tools and strategies to support our teams. Currently, we're meeting with clinical leaders to establish an inventory, and through some very rich discussion, this inventory has captured the successes and best practices, as well as some of the barriers that our teams are facing. Once complete, this information will be used to support the dissemination of best practices across the organization and to collaboratively develop strategies to overcome the barriers that are identified. Next slide. There are currently several initiatives underway, and today we seek to highlight some of our successes. One initiative that we continue to celebrate and expand on is the Internationally Educated Nurses Program. Through the IEN Integration Program and the Supervised Practice Experience Partnership, we continue to recruit and retain a significant number of nurses across all sites. The Clinical Extern Program is another initiative to celebrate today. Since its inception in January of 2021, this program has provided Hamilton Health Sciences with access to a previously untapped clinical resource, enabling units to provide safe patient care. The overall feedback from the externs themselves, the clinical teams, and their leaders continues to be overwhelmingly positive. This program has also offered a unique recruitment opportunity during these challenging times. And here are some quick facts. We now have more than 220 clinical externs across the organization, and we're continuing to hire more. Of the externs who have graduated, we've hired 126 into nursing roles and another 7 into respiratory therapy roles. And I'll end my section with some really great news. As a testament of the value of this program, the Ministry of Health has recently announced continued funding of the extern program for yet another year. Yelena, back to you.
Thanks, Diane. Those are some impressive areas of work. I also want to share some things that we're very excited about that built within our teams. Another area of work is our Essential Care Partner Program. We have run some pilots in partnership with our patient experience team, the medicine program at the General, and our oncology program. And this has now led us to be in a position where we can spread our work, beginning with our seniors portfolio. This program will allow us to formalize bringing in care partners and families to support the care needs of our patients. While it's work that has been done informally and intuitively with our teams, this new standardized program will allow us to continue to better meet the needs of our families. The other area that we're very happy about is that we've supplemented many teams with healthcare aid roles. We now have over 300 healthcare aid positions in our organization. And in April, there will be another 20 joining our NRT and CRT teams. These folks come in and receive additional information about seniors' care. And working in a collaborative model with our team, we're better able to provide patients with support for their basic ADLs, with falls prevention, allowing us to prevent pressure injuries, and to be able to provide senior-friendly practices to help our patients have better outcomes when they're leaving our hospitals. Of course, as Diane said, there are numerous stabilizing initiatives underway, and we don't have time today to talk about all of them, and we'll have an opportunity at future town halls to share others. And so we want to thank those leaders and those teams for all of their leadership and support in making that happen. Next slide, please. We want to leave you with some final words and some requests. We ask you to continue to look for ways to build workforce stabilizing initiatives into your models of care. And Diane and I are always open for you to tell us your ideas, to identify the barriers you're facing, and share your support needs. Of course, either to Diane, myself, or anyone on our committee. And we will do everything possible to work those through. We ask you to prioritize the work coming out of the Model of Care Committee. We continue to refine our processes and develop new templates. And we ask you to consider to be a pilot site as new initiatives are emerging and we're testing areas of change. Thank you very much. And I'm going to hand it over to our next presenter.
Thanks, Elena. Thanks, Diane. Next up, we have Michelle Leafleur, Vice President, Health Information and Technology Services and Chief Information Officer, with an update on our digital health and governance. Michelle, please go ahead.
Thank you very much, Joanna. Hello, everyone, and thanks for your time today. I'm happy to be here to provide a quick update on our digital health and what's happening with all of the optimization requests for Epic that have been received since our go live last June. I'm happy to report that we're ready to move on to optimization and to make improvements to our modern hospital information system to make it work even better for you and, of course, for our patients. Next slide, please. With Epic now stabilized, we are ready to receive requests for improvement opportunities. Starting this week, we welcome programs through several operational committees to consider ways you'd like to see Epic work better for you. This could be to improve a workflow or to make a change in an existing program that might better suit your area of care. Opportunities must be endorsed by an operational committee or work group and submitted by that group's chair or delegates. They will complete a new form that we provided to them and to the leaders across the organization. Once the form is submitted, it's going to be received into a new committee under the digital health governance. This committee is called the Digital Health Intake Committee, and I'm going to speak to that a little bit more in a second. It will also be reviewed by our optimization review board for feasibility, cost, resources, etc. Importantly, for those of you who submitted a ticket during the post-live phase for an optimization item, you will soon, if you haven't already, get a standard message indicating your ticket has been resolved. What this means is that your idea has been sent and forwarded off to operational committees to get more information and to get an official endorsement at a committee level. You do not have to resubmit your previous ideas, but we do thank you for those. Committees will be responsible for prioritizing with programs what the programs need most, and then endorsing those ideas before submitting them on the program's behalf into the Digital Health Intake Committee. Will be communication on what requests the operational committees have submitted for consideration, in addition to the targeted timeline for development and enablement in EPIC. Please remember to continue using existing channels should you require everyday general support. We're still here to support you in moments of need. These are available, as you know, through the Learning Home dashboard or in EPIC, or by contacting the help desk or opening a ticket through My IT. Next slide, please. Here's a quick rundown of how that works. The operational committees and work groups will be receiving ideas from across the organization, and they will themselves prioritize and endorse what should move forward for consideration, submitting the form into the Digital Health Intake Committee. I do want to make note that the Digital Health Intake Committee is a very large, multi-interdisciplinary team with representation across the organization. So as requests comes in, they can be looked at holistically to make sure that the impact is agreed on by all around the table. The Digital Health Intake Committee will prioritize requests and approve for next steps, ensuring that we have alignment with the organization's vision and strategic directions and objectives. And really the focus will be on high impact changes. This will go then to the Optimization Review Board, where it will be assessed for feasibility, options for development, resourcing, and of course, scheduling for delivery. Next slide, please. A quick message for those who sit on operational committees, who will be in charge of reviewing, prioritizing, and finally endorsing improvement opportunities brought forward by the clinical programs. You can expect, and many of you have already seen, HITS analysts embedded in your committees. This is quite a change. The HITS analysts are there to support you through this new process, be part of the conversation about things that you can explore from opportunities, and ensure that things move forward well. We're also asked of the operational committees that you work with practice councils, quality councils, and others impacting your area of care. Basically, bring as many voices to the table as you need. Ensure the opportunity makes sense for everyone involved. Also remember to keep your stakeholders informed as best you can. Next slide, please. Here's a rundown of how you can enter a request should you have an improvement opportunity. We don't want to be too directive here. Use whatever your care area is comfortable with when coming up with improvement opportunities. Generally, this is via your CQI tools, like your Daily Huddle, for instance. Leaders and delegates should bring these ideas forward to the operational committees, where it will go through the process that I just reviewed. Two examples that you can see on the slide as to what an opportunity is, be it things like interfacing new devices or new workflows. Many ideas are out there around improvement opportunities already. Next slide, please. Just a reminder, for regular troubleshooting, if you are stuck in a workflow, you have access issues or printing or other things that are immediate, of course, we're still there to help you with those. Please either call the help desk or open a ticket in My IT, and we'll address those things in our regular fashion. We appreciate that this is a new way to work for everyone. Our goal is to make EPIC work better for everyone at HHS. So we encourage our leaders, staff, and physicians to work with the programs and operational committees to bring about those improvements. Please, as always, visit the Hub for more information about digital health initiatives and EPIC. And thank you for your time today, and I'll hand it back to you, Joanna.
Thanks, Michelle. Thank you for that presentation. Dr. Yeshke is on the line. I just want to make sure that we can hear him and see him. Dr. Yeshke is our Vice President of Research and Medical Director for Burns, and a new panelist for the town hall today. Dr. Yeshke, you should receive an invitation to unmute your microphone and turn on your video. Go ahead.
Yes, thank you, Joanna. And I hope you can all hear me. Maybe a quick confirmation from somebody.
Yes, I can hear you. Please
Beautiful.
Go ahead.
Thank you very much. Yes, thank you very much to be invited to be a panelist today and to talk to you all about research. Next slide, please. So research at HHS is part of the strategic plan of the corporation. And in recent time, and maybe some of you know, I joined as of July of last year as Vice President of Research, is to also integrate research much more in the hospital mission and the academic mission of our hospitals. And maybe to just go back for a second to give you an idea what research at HHS more or less is at this time. We have 5 pillars, which you see here. We have some population health research, We have some thrombosis, some translation research. We have the Escarpment Center Research Institute with Cancer at the Jovinsky. We have offered for youth and child studies, as well as the geriatric. And you see the respective leads of these institute and centers below. So how is research? And next slide, please. That's the outcome of the output. We are ranked in the top 10 of our research hospitals in Canada. We have about 750 trainees. We have about 900 research staff, 550 researchers, and overall 2,300 members in our enterprise, which is quite significant. And we have a global involvement as well, with over 1.5 million participations globally. Next slide, please. So we are doing relatively well, but as you can see in this table over the last years, we can see that HHS research has faced challenges. And the challenges are that the revenue per scientist has been steadily declining. And you can see here that it went from 210 million down to 138 million. And that is a threat and a risk for the research enterprise. And we went from number 3 and 4 to number 7 in Canada. And we had a 19% decrease in research funding. And this is, again, very much on our mind and our radar, and also to the leadership team and the board. Next slide, please. And that was very key for us to see these signals that we are facing challenges. And so we engaged in a strategic plan. Last year, we were successfully to recruit a strategic plan company called Spindle, which is a boutique company and a fantastic collaborator. And what we've done is, with the mission, develop a strategic plan for research that is reflective of all of our constituents' vision and perspective. And it is ongoing from a research side, very strongly ongoing. And we're discussing also, obviously, to get even broader engagement. Next slide, please. The priorities in the exercise is meant to understand how HHS values and centers research in its mission, what can be done to instill a culture of research in everything that we do as care provider in this organization, and systematically lift and support pockets of research excellence by interdisciplinary staff and physician scientists across all of HHS. And the goal clearly is that all of HHS research is empowered to create breakthroughs that can drive innovation, leverage the existing knowledge bases and resources. And we see this as a significant strength of HHS. And one example, the next slide, please, you'll see what we actually started, and I'd like to introduce today a little sneak peek, because officially this will be launched in April. But we're creating a platform we call Drive, and that is to enable and really encourage all of HHS team members to become innovators and entrepreneurs. That basically means entrepreneurs, but within an organization. Anybody can be part of this, and we believe also anybody can be an entrepreneur that works at HHS, and irrespective of whether you're a scientist or not, a clinician or not, or any team member that works even in administration, anybody is invited to join. So it's open to everybody. And what we're trying to do in the next slide, please, is with this to establish a platform that will lead to innovation, that will lead to entrepreneurs, but also improve the care so that we truly have that aspect of academic mission and get engagement from our entire team. We already established an advisory board. We have various financial support. And again, I'll summarize this. This will be formally launched very soon, but we see this as an engagement I'd like to present to you today. And this is part of our strategic vision and mission in the near future. And I would ask you please to contact that. Here's the email. If you have any idea or anything that you see as innovative and you want to ask us questions, so we're open to everybody. Next slide, please. But let me summarize. I think the HHS is uniquely situated and has incredible talent. And with its caring for patients and the patient population, we are a true academic hospital. And I think one of the aspects I discovered over the last weeks or months since I've been here is we have to build bridges, and it's just bringing all the talents together to really propel and excel for the future of research. And I think this will be significant contributing to sustainability. And with that, I would like to thank you for the opportunity, and I'm happy to answer any question.
Thanks, Mark. Thank you so much for sharing that. Lots of excitement around the new initiatives in research and happening throughout the organization connected to EPIC. connected to our workforce planning. Just a reminder that if you do have a question and you didn't have a chance to put it in the Q&A tab, you can always send us an email at hhsnews@hhsc.ca, and we'll do our best to get you an answer. A reminder that our next town hall is currently scheduled for a month from now on Thursday, April 6th at 11:30. Sometimes things change and we'll have something more frequently, but for now we're on a monthly cadence. And now we're at the portion of our agenda where it's time for celebrations. So I'd encourage any of our panelists or anyone on the call who would like to raise your hand and give a live shout out. You can do so now. You can also type it in the chat forum and we'll have a chance to read it out for you. Dave, I might suggest that you and I can maybe take turns reading out anything that's typed into the chat box. Is any of the panelists coming off mute wanting to give a celebration today?
Yeah, thanks, Joanna. And yeah, absolutely. Put forward any of the shout outs that you'd like to offer. They're starting to come in the chat. I see those, but I also see Les Gauthier with your hand up.
Yeah, thanks, Dave and Joanna. People may or may not be aware the Ontario College of Pharmacists is in doing our accreditation this week. Today is day 3. They've been to the General, the Juravinski, and they're at McMaster today. I just really want to celebrate the pharmacy team. They've done great work to address a lot of issues we had to address. The entire organization is feeling it. It's all the automation that's come in for pharmacy. It's tremendous work with our colleagues in Capital to redevelop clean rooms and build new spaces for us. And I know it's had really significant impact on frontline nurses and physicians. So we're hearing really good news as the visits are happening, and just want to congratulate the pharmacy team on the achievement and thank everyone else who was a part of it, including our EPIC colleagues. It was a big shout out.
Thank you so much, Leslie, and congratulations to the pharmacy team for all that ongoing work. A couple of celebrations coming in the chat from Caroline. Happy Social Work Week to all our social workers. Thank you for all that you do for our patients and families. And from Liz Ferez, celebrating the Juravinski ED for sustained improvements in ambulance offload times. Also, I see Yelena, you have your hand up to come off mute.
I just want to celebrate the many healthcare aides that we talked about that have joined our hospital setting, and for the teams that have embraced new ways of working. They certainly are always so thankful to the clinical teams for what we do for the patients and so willing to take on additional work.
Terrific, thank you. Dave, do you want to read a couple of these coming in the chat?
Yeah, I actually want to come back to one you mentioned. So celebrating the JHED for sustained improvements in ambulance offload. When I first saw some of the numbers, I thought it was a mistake. They were so improved. So really, truly congrats on that. Also, thanking those who have participated in recent stakeholder engagement sessions related to scheduling and Kronos renewal corporate project, a huge project that has lots of elements to it. So thank you for that. We're seeing the comment here that pet therapy is back. Many patients and staff are very happy to be with our furry friends again. There's nothing like a furry friend, so very happy to celebrate that. And also see a comment, a shout out to our oncology decision support and coding team. Oh yes, for all their work. In fact, I was in a room yesterday with that team and thank them as well myself for all the work they've done on HITS, Beacon, and Cohedo teams to finally get our visits and treatments submitted to Cancer Care Ontario for funding. It's been a struggle transitioning and has taken amazing teamwork along with our oncology clinicians to get us there post EPIC go live. It's a very complex set of data that needs to be worked through and submitted cleanly, and it was a tremendous, huge accomplishment. I'm echoing that myself.
Yeah, thank you, Lisa, for that shout out. We don't have any others in the chat at the moment. Going once, going twice. I don't see other hands up at this point. So thank you everyone for joining us today. Dave, I don't know if you have a few closing words for everyone But thank you for being here.
No, nothing substantive. Just thank you again so much for spending some time with us, but also everything you do for not only our staff, pardon me, our patients and their families, but what you do for each other. So I hope you have a great rest of day and stay safe.